I'm Dr. Shravani Gupta. I'm the head of the acute pain service at the Sydney Adventist Hospital. Opioids, some common ones are endone, targin, oxycontin, are often taken for longer periods than we usually like. They are best used only for a few days or a few weeks maximum after any surgery. Rarely they may have to be used for chronic pain, but we often see patients coming in from the community on relatively large doses of opiates, and this can be a problem. In the acute phase, opiates can cause things like constipation, slow breathing, sedative effects, nausea, and these can sometimes continue in the long run as well. In the long term, opioids are often associated with a risk of falls and difficulty driving because of its sedative effects. There can be impaired immunity. We often see a drop in testosterone levels, which is the male sex hormone, and there can be psychological and physical dependence, which can be a huge problem and quite difficult to treat, especially if a patient has been taking opioids for months and years even. With relation to the pain itself, we see something that's called tolerance. What typically happens is the patient gets started on a small dose of the opioid, and as it is titrated upwards, the amount of opioid needed to control the patient's pain, the same pain, keeps going up because the patient develops tolerance to the medication. And a lot of patients describe it as immunity to the drug, and which is why they need more and more of the medication to treat the same pain. The other thing seen, not that commonly, is opioid-induced hyperalgesia. And what happens is that the drug itself, through a very complex process that we will not go into, can worsen the pain. And it can sometimes be quite difficult to tease out tolerance from opioid-induced hyperalgesia. In the case of the latter, decreasing the dose of the medication can actually be beneficial. The goal of good pain management is basically to not just reduce pain, but also to reduce physical disability and improve self-reliance and independence. In patients who have chronic opioid use, this very goal can sometimes get hampered. Data has shown that patients with more distress and physical disability are the ones who are more likely to use opioids long term, and hence it becomes like a vicious cycle which is very difficult to break. Since chronic pain is quite a difficult issue to target and treat, it is really important that we pick it up sooner rather than later. It is never too early nor too late to see the appropriate specialist. If in doubt, always see your GP first. There are a number of good GPs out there who have a special interest in pain management, but if you feel that for some reason the treatment that your GP is giving is not helping as much, it is worthwhile to see a pain specialist. So ask for a referral for a pain specialist and see them early rather than late. Thank you.